Every patient that comes in here with hair loss, always what they want is actually their hair back. So, of course, as a hair association doctor, we want to help every patient who loses their hair after knowing what is the causes. Most important is they understand what is the causes of hair loss and then what we can do for them. And for example, whether they are suitable candidate to do hair transplant. But then sometimes there are times that we have to say no to a patient, unfortunately. We have to do the assessment and management of a patient who suffers from body dysmorphic disorder. These are the people in a group that they always think that their body image and the body image is always not perfect. You know, they keep on coming in and saying their hair is not right, and then their lips are crooked and their face is not balanced. They, you know, every time coming in to say something mostly about the hair all the time, this is not straight, that even before doing the procedure, and they have gone to many other doctors too, also telling the same thing, and then they come to you, they tell that this doctor has said this, that doctor has said that, and then you have to assess them. And these are the patients that you need to give them more of a psychology advice, and then not to touch them, because they'll never be happy with your results, because the expectation is perfect.